Hello, hello.
Good morning, everyone.
Welcome in.
Yes, thanks for joining us. Wow, we sound very
Here,
excited to be.
take two. Take
we
two.
we were both just talking about how tired we are and how he got up much earlier than I did today, but
This earthquake all of a
yeah,
sudden.
yeah, seriously. I think especially you, I can't complain very much, but especially you, we're halfway through AEP right now,
Mm.
and I think people are feeling it.
Mm-hmm.
I think people are that fatigue is starting to set in. Honestly, this year it probably set in a lot earlier than halfway through, just because of all the craziness that's going on. Which,
Yeah,
again, that's why we do these still through AEP, is
100%.
because we want to make sure that we're updating everybody. So, yeah, we'll dive into that in a little bit. But well, what time is it?
We got a couple of
We have
minutes
a
or
few more
so. And
minutes.
so I will
Yeah, yeah, yeah.
throw this is what our fun part of the cafe or whatnot, the pre-cafe chat. So we'll get started here in just a couple moments, but feel free to throw in the chat, welcome in, say hello, tell us what's on your mind. Obviously, if you enjoy what we're doing here, make sure you smash the like button, smash the subscribe. Might as well get that little plug in real
Yeah.
quick. Now, we do not technically have this line here today. This is Olivia's direct line. But feel free to
Yes.
still bug her. She's actually out doing some video stuff with Integrity.
Mm-hmm.
So a huge honor and a huge nod to her as a giant in our industry. And we
Yeah.
are very fortunate to have her as part of our company. So
Yeah,
wish her some good luck or just let her know that you're thinking of her or whatnot.
for sure.
So that'll be that line. I'll leave that up for just a little bit. But you mentioned tiredness and all that type of stuff. I would have to completely agree. I feel like AEP started also so much earlier this year because of all the prep and everything that we had to do.
Yeah.
And the uncertainty of some of the resolution that we still are working through and the Inflation Reduction Act and everything that's gotten put into place. I feel like we not only started so much earlier, but like you mentioned, like there's just it's so much more packed full
Yes. Yeah.
this year.
And we're even going to, on Thursday, we have a webinar. Olivia and I have a webinar about it, but AEP is going to be like extended through
Yeah.
SARs and OEP and all that sorts of stuff this year as well. So join that if you would like to. But yeah, it's going to be one long enrollment season,
Yeah.
that's for sure. But I think before we start, we need to address the elephant in the room, or shall I say, the hamster
This
in
is
the room.
this is a pig. Actually, this pig over here.
What's going on with the lower half of your face these days?
I wish I could tell you.
I'm sure Emily wishes she could tell us too.
Quite literally. No, I am partaking in what our office does every November, outlined as Movember. So a lot of the guys in the office become more unsightly than we normally are, in the fact that we all have some type of mustache. And I've just come to terms the Lord was not intentional with giving me the ability to grow facial hair, and
Sure.
honestly, that's okay. I feel like I grow top of head hair
You know,
plenty fine.
this isn't relatively, it's not that bad.
Which usually mean it's terrible and you're just being polite. And I appreciate that. That's super kind of you.
I
I
think
am not a huge
I
fan.
am starting to have Stockholm syndrome to all the mustaches in the office every November. But it's so fun. It's something that we do to raise it's Movember, so mustache November.
Hmm.
Lots of places do it, but we do it to raise money for our care program
Yes.
here. We raise money for another organization called Cancer Care. And
Yes.
so that's one thing that we do in the office. So all throughout November, you will be seeing mustaches. Whenever Clayton gets on here, you'll see his lovely mustache.
His looks good. Like,
He's perfected it. He is the mustache king, though. He
sure.
is like the resident mustache king
Yeah,
here.
I would agree.
So it all works that he runs Movember and he's also the mustache king.
Yeah.
It just makes
It just
sense.
fits very,
Yeah,
very well.
absolutely.
I'm the mustache jester who runs around.
Jester.
Hello,
My
sir.
lord.
May I make you laugh today? Like, and then he just looks at my face. So
Yeah, so it's crazy in here, not only because of mustaches, but let's dive into the last week that we've had.
yeah, so we are during AEP, we are wrapping up and doing these kind of shorter style podcasts, cafe episodes, and we've labeled them What's Brewing. And the whole point of these episodes is to not only help you guys take a 20-minute breather break and decompress and kind of turn your brain off. We will do the thinking for the next 20 minutes, but I'm not liable for anything after that. And then from that just allows you guys to reset, maybe, do whatever you need to during this time while you're still engaging in our industry. We're going to talk about things that we've seen over the last week or so. I know last week we heard from Carrie, Olivia, and Matt Carson about a lot of the non-commissionable plans and the plan suppressions that are going on. And, news flash, those are obviously still going on
Right.
and still impacting our industry for sure. I had written down a couple of other things that I personally and the team that I'm associated with have been answering or whatnot. And so
Yeah.
I'm happy to kind of touch on some of that stuff. But throughout this entire thing, again, we don't have the text line here today, so I'm going to go ahead and cover that up. But we'll probably bring it back at the very end so you guys can wish Olivia good luck or whatnot. But please, if you're joining us live on YouTube here today, we do have the chat open. We'd be happy to answer any questions. But without further ado, I guess I'll kind of jump into a couple of the things that I've been noticing over the past week or so.
Yeah.
One of the big ones are some staple documents in our industry.
Mm-hmm.
Everyone knows the CMS landscape. I would say less.
Hopefully.
Yeah. If not, and that's okay too.
Yeah.
That's why we have these. Reminder, there is this thing called a CMS landscape.
Yes.
It is a very, very beneficial tool that can be found if you just type in 2025 CMS landscape on Google. It'll be the first one from cms.gov.
Mm-hmm.
Download that. I highly suggest having a copy of that on your desktop or your laptop or wherever you go. It's usually a big Excel document. And it's going to outline every plan that is available moving forward into 2025. Why is that beneficial? Well, we've seen a lot of changes this year. A lot of plan changes, a lot of plans being removed. We talked about the service area reductions. We've talked about, I've probably answered a handful of times already this past week and a couple times yesterday, hey, this plan was here in this county last year, but it's not popping up.
Right.
So these plans are, experiencing these service area reductions, and that landscape is going to be a huge resource to see exactly what counties are being serviced by those plans.
Yeah.
It'll help you see maybe what other carriers or organizations are servicing plans in your counties or surrounding counties as well. So it's just a really good benefit or a really good document. It also shares some of those initial benefits. So you're looking for the lowest maximum out of pocket. Usually that's listed on the CMS landscape as well. Star ratings, as those will get kind of updated to that document, can be found there as well. It's just a very good organizational piece.
For
and
sure.
In a time where it's very easy to become disorganized, using that and offloading some of that information onto a document of that nature, super, super helpful. I use it all the time.
Absolutely.
Probably more than... I was going to say more than I should, but it's literally my job
No,
to
no,
use
no.
it. So
Yeah.
I use it a lot.
For sure. It's one of those things where you just kind of have to rely on because that's how you get stuff done. That's what it's there for. But it's also a document that we look for every single year, and then it's a big announcement whenever the landscapes are announced. But like you said, there's like a lot of changes being made. There's a lot of changes being made actively. Day by day, we're getting emails all the time of new things happening with all these plans and changes being made and whatnot. So yeah.
And part of that too, a lesser known document that I use as well is the plan crosswalk. If you type in CMS plan crosswalk into Google, it'll be the first one from cms.gov. The biggest thing on this one is it filters from oldest to newest, so you'll need to type in, either go to the last page on the search within cms.gov's website, or if you can filter down to 2025. This is going to tell you exactly what plans changed. H numbers are no longer around, all that type of stuff. A plan or an H number that experienced any type of change, a name change is a really big one. I know there are several carriers that have rebranded or named their
There's been
plans.
a lot. Yeah, a lot of
1,000%.
Yeah.
And so that document is going to say, hey, this is what the H number is in 2024. This is what it will be in 2025.
Yeah.
This is the carrier's plan name going, into 2024. This is what it will be for 2025. So just a couple of those two documents would probably answer, 10-15% of the questions that we are getting, which is good. Please bring your questions to us. That's why we are here as a resource. But someone who is always looking to offer, what am I seeing? That's what I'm seeing right now. Yeah, we have a couple of videos on YouTube as well that talk about using Excel, very similar aspects to filtering out the CMS landscape. And then on our AP toolkit, we even have a video, I believe, of how to use the landscape and all that type of stuff. So those are really helpful.
Question, is someone who doesn't actively use the landscape very often, or even like this crosswalk, I've just started hearing about the crosswalk. It's very relevant this year. Yeah. These are live, or I guess live documents isn't the way. Like if you download it once, do you kind of have to re-download it every day to see like what's new?
It's a really good question. So every day might be overkill, but exactly as you aligned, they can only produce the most updated information as quickly as they have it.
Yeah.
So this would be something that I would frequent, probably weekly, would probably be pushing maybe every 2 weeks. It's not updated very often, but if it is updated, then you would be using an old edition. So it's important to have the most updated one for sure, because like we said, we've seen a lot of changes. We are getting on a daily basis emails. Agents like yourself are probably getting emails, and you guys just may not have as much time to look at all of the emails you're getting.
That's exactly right.
And so it's definitely an important aspect to keep in mind. Those emails are many times trying to provide some type of value and information to you as an agent about either your commission, their plans you're offering, the carriers you're associated, heaven forbid, certifications that may still need to be wrapped up. Those emails are important, but so is your time. And I understand you guys are sitting in front of clients and taking care of people right now. And so all that being said, exactly what you outlined. Once you download it, it's not going to update automatically. It's something that I would probably revisit from time to time and just make sure you have the most updated one downloaded. So that'd be helpful for sure.
Some exciting stuff that's come out recently.
For me,
Yeah. Hey, this is something every single year that people get excited about. They talk about whenever we had really consistent webinars on every single webinar around this time of year, they'd be asking us all the time. So it
is probably the most asked question of like September 15th to October 15th outside of am I ready to sell?
Yeah.
It is followed with, hey, what are the 2025 Medicare costs? What are the 2025 Medicare numbers? When is that going to be released? Where is that information? So I am happy to announce that those are actually out now. I think they came out late last week, maybe Friday or Saturday. I found them Monday morning while I was sipping my cup of coffee and, enjoying my morning.
Yeah.
And as one does, peruses cms.gov.
Of course. Yeah. With the mustache.
Yeah, exactly.
And the coffee.
Twirl. Mine doesn't twirl, but. But yeah, and honestly, so these 2025 numbers are out. And so what I did was in the Facebook group for the Medicare Cafe, that got sent out yesterday. So if you want the document that outlines all of those numbers, the website is in the Facebook group. And then I did a high level, like these are the big numbers, and I will share with those with you guys now. If you have a pen and paper, feel free to grab them. But your Part A deductible is going to go up a little bit to $1,676, including on the Part A side, the inpatient and skilled nursing facility stays went up about 3% or so. Those were some ranging numbers between days 10 and 91, or the second set of days. Yeah. And so those went up about 3%. So you can guys see those numbers on the website as well. And the big ones are Part B side. So Part B premium went up to $185, up from $174.70. And then the Part B deductible is at $257. And so we expected some increases.
Sure.
I think it's pretty much right in line with what a lot of people were predicting. I think
Yeah.
if you
And
were
what happens year to year?
exactly
Yeah.
if you were Googling these types of numbers, you saw a bunch of predictions, and I think these fell right in line with a
Yeah.
lot of those. And so those numbers are officially out. And I mean, us internally, we like those numbers too because we have some really good resources that I know are on the university and the toolkit as well. And
Yeah.
I'll let
I
you
have some
kind of.
updating to do on some of those resources and stuff. But yeah, you'll be able to find those numbers. We have lots of different resources and whatnot, including those. But just remember that a lot of these costs are going to be covered by plans or something like that. So you don't have to worry about them too much, but it is one of those documents that's just really nice to have all the time, kind of like a Medicare and You
Yeah.
or something like that. It's just good to have downloaded on your computer. Give to people like to know that. So whenever you sign them up for a plan and whatnot, handing those out as well. But yeah, that's all I have to say about that.
Yeah, I know inside the Facebook group as well, after I had posted it, an agent had mentioned that like our fact sheet for those Medicare costs is one of her favorite handouts or flyers that she takes to events. And her clients like to have those numbers inside
Yeah.
their own house. So now they have a document with those numbers and her, agent information on it. So our marketing team is fast at work making sure those resources and documents get updated for you guys.
Yeah, they have
And
quick turnarounds over there. Yeah.
they are some of the best in the business for sure. And I will make sure that those documents and everything get uploaded to the Facebook group as well. So as soon as those have finalized and are taken care of, I will post those and make sure everyone sees those. That way you guys have them out. Just like you said, Sadie, I mean, these are pretty standard numbers. If they're not used to paying them, because they're already paying them, they're just not used to probably seeing it. The only ones that you may run into some cases are Part A if they are paying for Part A.
Right.
That also did go up. That's a little less common, but all those numbers, are good to have access to
Yeah,
for
sure.
sure.
Shocking prices going up in any sphere at all.
Right?
Crazy.
What? I remember when we used to
Sick of
get
it.
gas for a nickel.
No, literally.
Not me.
No, not me either.
Yeah.
I said literally like I wasn't born in the 90s. Like what?
I'm gonna drive until like
Literally so
2010.
relatable, so relatable.
That's amazing. Let's see. Some of the other things, speaking of kind of prices and going up and maybe a way that you guys can combat that. So we are halfway through AEP, like Sadie mentioned. And part of that, as we get into December, we're almost halfway through November already, which
Bizarre.
is,
Yeah.
I
We're almost
feel-
at Thanksgiving. You guys, you've almost made it to Thanksgiving.
It just seems like, where did the time in between? Like, we just celebrated Halloween,
Yeah.
and just prior to that was 4th of July.
I would be interested to hear, because this is a safe space. I'd be interested to hear for any of you guys that have been writing this AEP if it feels like time has flown
Yeah.
or if it hasn't, because this year was just so weird and just so busy. I can see it being, going either way where people are
1000%.
like, no, this has been the longest AEP of my life.
Yeah.
But yeah, anyway.
Yeah, I was like, oh, I'm fitting so many appointments in such a small amount of time that like the day is grudgingly going by.
Right.
But then like I woke up and it was November. And
Yeah.
It's like, what? So we're in a weird paradox of
Yeah.
time. But some of the fun stuff is, like Sadie mentioned, we have Thanksgiving coming up. And part of ending AEP will be Christmas time and all these other holidays around that time of the year. If you celebrate, and a lot of people, want to make sure they can kind of go a little extra, a little all out, and enjoy that time with family and friends. And part of that is being able to, maybe having a little extra cash. The business that you guys are writing right now traditionally doesn't pay out until the middle of January, sometimes even pushing a little later depending on carrier processing and making sure CMS approves a lot of those. If it was like a T65, all that type of stuff gets delayed. Well, Christmas doesn't delay depending on AEP payment. So one of the things that you guys can look at are carrier incentives. They have a lot of cost share, co-op, lead generative, extra just bonus money. These carriers are putting together some really awesome programs to support you as an agent. I think carriers felt it this year as well, how impacted and how much change there has been. And so they want to make sure that they are supporting the agents that are, it's a partnership.
Mm-hmm.
And so they are looking through, some of them are as easy as like 3 qualifying apps. And you could get like an extra $50 per app. So you're probably already writing the business. And especially on some of those ones that could go either way, maybe a premium that's within 50 cents on a supplement,
Yeah.
or, asking that one extra ancillary question during your AEP appointment,
Mm-hmm.
all those type of things, while they seemingly take your time, it is worth it, 1,000%. The benefits, the beneficiaries getting better coverage, you're going to see payment a lot sooner, and
Yeah.
it's just
HRAs are one of those things where people are like, I just like don't have time to do that, or it's just like that's one more thing I have to do, and then that's one more. But then we talk to the people, we have like agents who are like, I don't have time for that, and then we have the group of agents that are like, no, I'm HRA crazy.
I didn't even
write
think about
everything.
HRAs, honestly.
Oh well, yeah, sorry.
That's perfect.
But like this sort of thing where it's like these extra steps that you have to take and whatnot in order to make that extra money now or whatever it may be. We have like a camp of people that are like, I don't understand why anybody doesn't do it. You know what I mean?
It's like free money on the table.
Yeah, exactly. So it's like once you kind of get into like the groove of adding that sort of stuff to your appointments and whatnot, then it's like it becomes second nature, just becomes part of your process, and then you're also like making more money, earning those bonuses, like all that sort of stuff in the process.
I completely agree. And you're going to have both sides of it. One thing I will outline, some HRA carriers on if they're paying or when they're paying or whatnot have changed slightly. So just double check either with us or your upline or the carrier you're working with. Make sure that the plan that you are writing and hoping to do an HRA on is still paying that out. I would hate for you guys to add that extra time and then not see the benefit. So definitely double check on some of that. But the ancillary side, usually you can put that effective most days of the month and see payment pretty quickly on some of that as well. And just ask these questions. And I think this is also a really good time where if we're talking about adding things to your sales appointment, which can be stressful, there's one question that you can be adding to set your quarter one up for really, really well regarding annuities. So asking, while you're going through health coverage or everything like that, asking, hey, in addition to retirement and in addition to your retirement funds, how do you plan on paying for any other expenses that you may be occurring? Cost of living's going up. We're seeing these in changes. Someone who may have had enough money 2 years ago and had plotted it out may need to sit down and reevaluate what their monthly set income is.
Right.
And so asking that question, hey, in addition to how you're currently paying for this, how do you expect or plan? What do you have in place now to get you through to to the rest of your life? Which is it's a tough question. It's a heavy question.
Yeah.
But when you're coming from the point of trying to help that person, there's no different. We ask a lot of heavy questions in our industry already since we're talking about people's health. Asking that financial side as well and trying to put them in a better position to be able to pay for the health care that they need or the procedures that they might need. All that type of stuff is really helpful. And that one question can give you some insight on what you might be able to take care of, during quarter one.
For sure. And even like just from, the reality is like, you guys don't do this for free, and there's some pay cuts being taken just from commissions being cut and whatnot for Part D. And so we're seeing changes in our income, right? But like we're still wanting to focus on how to take care of, but at the end of the day, you still have to put food on your table. You still have to keep your lights on. So also annuities, of course, is going to help people, but it's also going to add extra income to your business by not adding very much to the process and not having to like go and get a whole separate like license. You do like the health and life and all that sort of stuff, but it's like, you know what I mean? It's not like you're turning into a full-blown financial planner. You're not adding like a whole extra thing onto it. So I'm sure that we'll be talking a lot more about annuities this next year just because we have been focusing on like, how do we get that extra income? How do people get this extra income that they might be losing, or just adding, even if you're not losing, even if like you didn't have to rewrite on a non-commissionable plan or anything like that, just like adding extra money to the table for things that are going to obviously help your client. That's what we do
100%.
at the end of the day. But then also like help yourself as well.
Yeah.
So
There's that two sides of that coin. You know, we talk about health is a very important part throughout the entire time of your life. The other part, the two biggest worries of the clientele that we're servicing is their health and their
their
finances.
finances,
Those are
yeah.
the two big things. And if you can, come to them and be able to assist with one, let alone both of those options,
Yeah.
you're going to be taking a lot of stress away from what they may be experiencing moving forward. So,
that's exactly right.
we have some really cool partners on the SMS side. At Retirement Realize, Caleb and Jesse are great folk. They do a great job of explaining on how to take you if you don't even know how to spell annuity, to being able to sell them and make sure they're benefiting people's lives. I would highly recommend if you guys are curious on what that looks like, send us an email, whatever it may look like. We'd be happy to help kind of either bridge that gap or see how we can plug that into your guys' business.
Yeah, for sure.
Speaking of other cool people, and I think this is one of my last updates here for today. We're talking a lot about the changes. We're talking about how people are implementing solutions, and we got to actually Olivia sent us over a message from LinkedIn that was talking about a company that was set to take on not a majority, but one of the largest amounts of responsibility for assisting clients with the M3P, which is the Medicare prescription payment program.
Yeah.
And turns out they're right here in town, which is really, really cool. That's
yeah,
where they was
in
founded.
our hometown, yeah, in Columbia. Yeah.
How cool is
Little
that?
old Columbia.
So the company is called Patient, Paytient. And so as of October 14th, as we were stepping into the new AEP year, they are set up to help basically run and power this payment program known as M3P, or the Medicare Prescription Payment Program. They will be covering nearly 40% of all of the responsibility that is helping this program.
Yeah.
Clients getting their drugs and then paying a little, incrementally over time. And to put that into perspective, that is the highest percent that any company of this type or this style is taking on. And that means it's more than CVS, it's more than Optum. So those two names are very, very well known in this space, both on carrier side, and they do amazing work. But it was really cool to hear that one of the companies here in town, founded here, have a similar message, one that we do, trying to help as many people as possible. And they're like, hey, we can do this, and let's just go do it. And so they're going to be taking care of people, which is super, super exciting.
Well, it makes sense that Patient is taking this over. And I know some people actually that work at Patient or have worked with Patient.
Wow.
Because again, like it's here in our hometown and it's a really cool thing. So it makes sense that they're taking it on, because that their whole business model is to work with like group insurance or groups of people, and they kind of help their give their those companies. Wow, this is really wonderful. A really wonderful explanation. Hang on. They work with group insurance, and the companies that have these group insurance, they can offer Patient as this benefit.
Oh, nice.
And what Patient does is they say, we'll pay this bill, and then with no interest, you can pay it back in payments.
Gotcha.
So it allows people who have insurance but still can't really like afford that extra like those big payouts or whatever it may be. It allows them to be able to pay it back in like in increments without being like penalized with some sort of like interest rate or something like that. So it makes sense that they're like shifting over. This is literally their wheelhouse. And I don't know if they do stuff with Medicare or do anything with like senior insurance. I know that it's mainly been group, but it's interesting seeing them move into, it's a perfect opportunity for them to move into this. So this isn't just a company that like raised their hand and said, hey, we'll do this. You know what I mean? Like without knowing, like this is quite literally what they do, but they're moving it into the Medicare space from what it seems like, from what it sounds like. So they're pretty cool.
That's awesome.
But yeah.
I feel like I have past experience. I was talking to Sadie a little bit about this earlier when we were looking over patient and kind of what it was set to do and what it's going to be doing and getting excited about it. I vaguely remember working with them while I was in college, and when they were I think they were founded in what, like 2006.
That's earlier than what I thought. I just know they've blown up in the last couple of years.
Yeah, that part for sure. But they've got a little bit of time underneath their belt, I'm pretty sure. But at one point, I remember they came in and spoke to us and kind of were talking about how they had established themselves in the area and kind of piecing some of that together. So I'm excited. I think it's always cool when you have a less than super known name stepping into a role and being able to do it, like you said. This is
or they're really well
wheelhouse.
known, but in the group space,
Yeah.
right? Like in something that's like slightly different. So we might not know the name. It might be like there's this random company, but in other insurance like areas, like people know the name Patient, or they're starting to.
Yeah, 1,000%. Yeah. No, that makes a lot of sense. I think that's probably a better way to say it, because like we don't see it in our industry, but that doesn't mean they're not absolutely kicking butt and taking names somewhere else. And so that makes a lot of sense.
Yeah.
It'll be interesting. It'll be cool. And at the end of the day, like I said, they are here in town, or at least that's where they were founded. So.
You know what? Maybe because Patient's just out here kicking absolute A. That's why we're finally getting a Trader Joe's.
and
did you know that?
Whole Goods.
Oh, in a Home Goods.
Home Goods.
Yeah.
Whole Goods. I said Whole Goods.
Well,
like Whole
Trader
Foods.
Joe's. Yeah. Exactly.
Mm.
All this to say, if you take anything away from today, Columbia's making moves.
Yeah. If you're looking
Trader Joe's, Home Goods, Patient, Senior Marketing Specialist.
Sure. Yeah. That's honestly, what more do you need in a town? That's awesome. It's exciting stuff. I think
exciting stuff.
A lot of people have been and have shared nervousness about what this prescription payment plan is going to do.
We just didn't know.
Exactly.
Like, no one knew. It was like, hey, this is something that we're implementing in like a month.
Yeah.
And no, we can't answer any questions about how we're doing it. And of course, like, we have to give some grace to our carriers because they were in the same place as, like, they're just like, cool, we have to make this whole like business model change and we have to be able to answer questions and stuff like that.
What do you mean we have to do something with an MP3 player? And like they were just as in the same spot as we were. So it's very grounding to hear that then we're starting to get some answers and not just an answer, but a seemingly one that's going to plug and play and fit very well. Mm-hmm. So that's exciting stuff. Well, those were the big things that I had. Anything on the Sadie front?
I don't think so. On the back end, you guys, I do training and education a lot, but I'm part of the cafe team. I'm in the background most of the time, but Q4 has been good. I've been spending a lot of my time into some exciting changes that we're going to make to the cafe, to all of our content and whatnot. So I've kind of had my head down and researching that sort of stuff, which is why it's helpful for me to be on here and ask questions and hear this sort of stuff because 100%. I'm working on this other side. But big changes coming internally at the cafe team, big changes that we will talk about every week. And thanks for joining us today, guys.
Thanks, guys. Hopefully this was a quick brain reset. I wish you guys the best of luck as we continue through the final 4 full weeks, I believe it is, of AEP. And like Sadie mentioned, we'll have lots of other opportunities to just extend past December 7th, past January 1st, MAOEP, SAR, LOL, TGIF, whatever it be. Exactly. You get it. You get it.
Totally.
Well, perfect. Well, we have to figure out what order we're going to do the thing in.
I about said have money. Make fun.
Papa John's.
We're so good at this. Olivia, if you're watching, sorry.
Yeah, we're really good at it. Well, you want me to start?
Yeah, you start.
Well, until the next week where we will talk about the updates that we're seeing from this point forward, have fun.
Make money.
And give impeccable service. We'll see you guys later.